pertains to this case, forensic pathology. I practiced for 10 years in Greenville County, South Carolina, as their chief deputy medical examiner, and I'm currently the chief medical examiner in Volusia County for the past 3 years.
Do you hold any professional, I guess, doctor licenses in any states?
Yes, I am licensed to practice medicine in the state of Florida and South Carolina currently.
During the course of your career in Greenville, South Carolina, approximately how many autopsies have you done when you were, and not specifically when you were there, but approximately how many did you do when you were there?
So total is a little over 4,000. In Greenville is a little over 3,000.
Let me ask you, you used big fancy words like forensic pathology.
Uh-huh.
I know you know what it is, and I do, but could you explain that to the jury, please?
Sure. Forensic pathology is a subspecialization of pathology that is particularly geared towards investigation of fatalities. Taking a body, evaluating the scene, looking at the body, drawing toxicology specimens, if necessary, taking histologic sections and looking at them under a microscope, actually the microscopic evaluation of organs, and then putting that all together to basically say one thing, why that person died. And then also to give it a medical legal descriptor of manner, which I'm sure we'll talk about later.
So pathology itself is the study, is that like diseases or?
Yeah, pathology is defined as the study of disease in the human body.
During the course of your career in Greenville, and then since you've been in Volusia County, have you had to testify as an expert in cause and manner of death in court before?
Yes.
Approximately how many times have you testified as an expert?
It's probably close to 130 by now.
As the chief medical examiner for Volusia County, have you had the occasion to review autopsies that were done by other medical examiners and then render an opinion in court?
Yes, I have.
In this case, you were asked, or to review the files for Robert Bayer and Peyton Baker. Did you do the original autopsy?
I did not, no.
Do you know which medical examiner did?
Dr. Pedrick Bulick.
Did Dr. Bulick pass away?
He did.
When you take on the responsibility of reviewing, autopsies, previous autopsies and stuff, what do you look for and what do you review in order to render an opinion?
I review the case file that the medical examiner's office has that starts with the autopsy report, the written document that the pathologist produces to describe cause and manner of death and describe in detail injuries and findings on the body. I then cross-reference these with photography taken of the body. Injuries, I cross-reference that with toxicology reports. Any x-rays that are taken, I look at carefully. And then if any histologic slides, microscopic slides, I also personally look at under the microscope if they are required in the case. I do rely minimally on scene photos and the investigator narrative, but generally most of my work is isolated to the autopsy report and the body itself, the photography of the body.
Do you also rely on the notes that the medical examiner, Dr. Bulick, would have taken like on diagrams and we'll call it like medical?
Sure, body diagrams. Yes, I did. I evaluate those too. They're consistent with the findings in this case.
And are you able to, based on your training and experience and expertise, able to render your own individual opinion based on these, separate factors that you look at?
That is correct. Yes, I have my own independent analysis of this case.
And I guess the biggest question is you have enough expertise where if you look at photographs and have some context, you can see the injuries that occur there and make a professional opinion about those?
Yes.
Were you asked, and you were asked to review the two autopsies for Robert Baker and Peyton Baker in this case?
Yes, sir.
And following your review of their autopsy reports, diagrams, photographs, scene photographs, investigator reports, everything you reviewed, are you able to render opinion about cause and manner of death?
Yes, sir.
Before we get to that, let's tell the jurors, what is the cause and manner of death? Since we're going to use that, what does that mean and why is that important?
The cause of death is why the person died. It's the proximate cause of why that person died, be it metastatic breast cancer, heart attack, myocardial infarction, pancreatic cancer, fall down the stairs with blunt force trauma to the head, stab wound to the back, gunshot wound to the back. These are all examples of a cause of death. This is the reason why the person died. In this state, manner is a medical legal descriptor. It's that pathologist's opinion. It can either be natural, which of course is related to natural disease, suicide, that person dies by their own hand, accident, homicide, which for us is that person dies by the action of another individual acting on them, pending, which means we're just holding for more information, and then finally undetermined, where after extensive work, autopsy, and investigation, the pathologist is unable to determine a manner of death.
You use the big word autopsy. I think we all have a general idea of what an autopsy is. Can you just describe the process that you go through when you do an autopsy, starting from the very beginning to the end?
Yes. An autopsy starts with the receipt of the body. The body will be in a body bag with a clip that's locked with a unique number on it. That's removed. Photographs are taken of the body as it's received without any cleanup. Then the body is cleaned. Then more photographs are taken. And then we start the process of the internal examination. In a case with an open wound or trauma, we'll be looking inside that wound, evaluating what internal structures are injured. We will then continue to open up the body, removing organs and examining them for disease. That could be heart disease, an unknown cancer, emphysema, lymphoma. All those are things we make diagnoses of. We then take all that information and consolidate it into our autopsy report, taking photographs along the way.
During the course of an autopsy, that's the initial phase, but do you also subsequently send off body fluids for toxicology?
Yes, we draw body fluids for toxicology and send them to National Medical Services, which is a reference lab near Philadelphia, Pennsylvania, and they do all the testing for us. There's a chain of custody, goes out in a box and comes back, and we get the reports.
And sometimes in cases where you can't see a specific cause of death, you would wait for, of course, to make your opinion until after you receive the toxicology back. Is there times, though, when you see specific injuries where you can make a determination before even receiving toxicology back?
That is correct, yes, sir.
So, for example, if you have a gunshot wound, you can use your expertise to determine that before you even get toxicology back?
Yeah, certainly if there's a very significantly fatal injury as a result of accident, suicide, or homicide, we don't need to wait for toxicology. We will still include it in our report, mind you, but the death certificate.
May I approach the witness, Judge?
You may.
Dr. Fulcher, I'm going to approach and show you what's been marked as states P1 through 8. Take a moment and see if you recognize these as photographs that were taken of the autopsy of Robert Baker.
Yes, these are photographs from the autopsy of Robert Baker.
Anything seem to be altered or changed about him?
No.
Fair and accurate depiction of the photographs that you reviewed?
Yes, sir.
Judge, at this time, the state would move in states P1 through 8.
Thanks. No objection, subject to our prior. Understood. Subject to prior objection.
I wonder if we'll get to save this.
I'm going to show you what is marked as 29A, Dr. Fulcher. Can you describe what we're looking at and explain to the jurors how that arrives, where it's placed initially, and then why it's important for that little blue marking to have, that blue little lock to have there?
Would the court like me to move to another position? Or is this
It's
appropriate?
easier for you to testify.
All right, then we
Yeah,
go.
stand up.
Everyone's view. Okay. This is the body bag. It has a zipper. These two zippers are locked with this U-line tag with its identifying number. This is the evidence that we have that this is sealed at the scene and brought to autopsy without being tampered with. This is the identifying autopsy number, District 23, the year 2020, autopsy number 539.
And that's the number that would be utilized through all the file work and everything like that.
That's correct. Yes, sir. This number stays with the body the entire time, including the toxicology specimens and any outside work.
Before we go into specifics, can you tell us how old Robert Baker was?
12.
How tall was he?
I will refer to the autopsy report.
Yes, sir.
I don't have that committed memory. The decedent was 64 inches in length.
So 5 foot 4 inches.
That's correct.
How much did Robert Baker weigh?
123 pounds.
Let's look at, if we can, 29B. Can you just tell us what we're looking at, Doc, and what just identify certain things that you see on there?
Sure. So this is the body as received, somewhat cleaned up. We have obviously the face, the head, torso. I just want to orient everyone. We have on Robert Baker sharp force injuries to the neck and then blunt force injuries to the head. We have the largest conglomeration of sharp force injury at the neck, an abrasion, an abraded incised wound, multiple smaller stab wounds, superficial incised wounds, and this is described as a semicircular blunt force trauma injury with a depressed skull fracture underlying.
We'll talk about that in a moment, but based on your review, are all of the injuries of Robert Baker basically above? I guess you would call this the torso, or mostly above. There's no injuries below his.
That is correct. In this case, all injuries are essentially above our white autopsy placard. We have a few superficial injuries above the clavicle here. Everything else is about the head and neck.
Let's talk about what the difference between a sharp force injury is, and then.
No, take a hammer to his head.
To understand.
Sure. Sharp
You
force
defend it?
injuries are caused by sharp objects, an ice pick, a knife, a hatchet, machete,
hammer.
something like that. It has to have a cutting edge. It doesn't have to be an extremely sharp cutting edge,
Oh,
but it needs to have some degree of
Sharp.
cutting edge. Pathologists generally describe two types of sharp force injuries: a stab wound, which is deeper than it is long, and an incised wound, which is longer than it
or a
is deep.
punctate
The
wound.
majority of injuries here are incised wounds, meaning they are long wounds that are not as deep as they are long. Blunt force trauma is impact to the human skin with a blunt object, meaning it does not have a sharp edge. Examples of items that might cause blunt force trauma include pool cues, clubs, bowling ball pins, obviously tools, implements, shovels, anything like that.
Would a hammer qualify as a blunt force object?
Of course.
We can talk. We're going to go injury by injury and have you describe what they are. But we'll start. This is 29C. If you can explain this injury, this we'll call it injury 1, going across the neck, and what actually the incised wound of the neck did to Robert.
Sure. I will start with the smaller wounds directly under the tag and then get to the larger wound, if that is okay. We do note a blunt force injury to the chin. This is an abrasion on the inferior aspect of the chin and jaw. This is just a superficial removal of skin due to a blunt object. This injury has no significant internal findings. It doesn't create a fatal injury.
Can I stop you for a moment?
Yes.
So this injury was not caused by a knife wound.
Correct.
This is from.
This is the one area of blunt trauma in this case.
Okay.
Sorry.
So there's a mix of blunt force trauma and sharp force trauma injuries in just this section right here.
Yes.
Okay. I'm sorry to interrupt. If you can go on to the other,
No
the
problem.
small.
So this is a slightly abraded, incised wound to the chin, the lower chin. This affects only soft tissue, skin and subcutaneous tissue. This has a depth of 1.2 centimeters. So this is really just into the subcutaneous fat of the chin. No vital structures would be injured here or here. This larger gaping wound with these additional satellite incised wounds is one of the more significant fatal injuries. This is described as a large gaping wound on the anterior surface of the neck. I'll point to my own neck.
You fucker.
That's 14 centimeters long
Oh,
and 5 centimeters wide
oh,
by 4 centimeters deep.
oh,
This wound
Fuck.
was explored and is noted
fuck.
to sever the larynx, the voice box.
How thick do you think a 12-year-old's neck actually is? Really? 4 centimeters deep.
Both sides of the carotid artery, both sides of the jugular veins,
Ugh.
and this is takes a fair bit of force. Both sternocleidomastoid muscles, which is a
So
very
there you
large
go.
muscle
See where he's
that goes
pointing?
from the sternum.
Those mastoid muscles there. He's max a third. He's 2/3 of the way through a fucking decapitation. You piece of shit.
Up to the base of the skull. One can feel it in their neck. So all that is transected.
What is transected mean? Is that
Ah.
Cut
just
in half, I'm sorry.
Yeah.
I'm sorry, Doc.
Yeah, everything's transected. and cut
Yeah.
in half. There are other photos, but we see the exposure of all these tissues.
Both.
Looking at the bottom of the lens.
Both of the major arteries. One going up, one going down. So the jugular and the carotid on both sides. As well as the mastoid muscles. The larynx and the esophagus.
larynx here, which is basically transected here.
It's as if
Your
the hammer
carotids and
wasn't
your
fucking
jugulars are
enough.
out to the edge. These are additional incised wounds.
Yes,
that are
the other
associated
way,
with this
Club.
larger gaping wound.
I was thinking you was very
What is the
quiet.
purpose of
Yeah,
your jugular
pretty much.
vein and your carotid artery? Why are they important?
That's why when I did the summary at the very start, I hadn't pre-read the goddamn script, and yeah, it's but yeah.
The carotid artery is the artery that takes blood from the torso to the brain, and the jugular is the vein that brings blood back down to the body from the brain.
And what I heard you explaining is humans have jugular vein and carotid artery on the left and right side.
Yes.
And in Robert's case, they were both transected or cut in half.
They are, yes, sir. You're looking at the bottom of the larynx here, which is basically transected here. Your carotids and your jugulars are out to the edge. These are additional incised wounds that are associated with this larger gaping wound.
What is the purpose of
That
your jugular?
max 2 minutes. He would have bled out straight away. No, sorry. I found it in trial archives. About 4 or 5 months ago, and I've been sitting on it, waiting for the right time, but I didn't realize how graphic it was. But yeah, I try and pick stuff that's old enough that either people can't remember all the details or they haven't seen. If I'm going to cover something that's older, because everyone streams, the current stuff. That's and yeah, I'm happy to do that as well. But I like to throw in some older stuff as well, just to be different, because I can. Good. I know you're waiting for Molly Tibbetts. She's there too. I've got all these playlists saved and hidden, like they're on my YouTube, ready to go, but they're hidden from you. So I just unhide them when I'm ready. Actually, I found a couple today. Just that have just happened, because I've got them all. I find them and I hide them in a little thing by myself, and then I go through them later when I've got time and see if they're any good or not. And then and then I watch them and I mark them in my diary until they're ready to come up. For the newer ones, anyway.
Why are they important?
The carotid artery
Gold
is the
star,
artery
gold star.
that takes blood from the torso to the brain.
Well,
and
it's nice to
jugular
have
is the
something
vein
different.
that brings blood back down
Yes.
to the body.
Yeah, I know.
And what I heard you explaining is humans have jugular vein and carotid artery on the left and right side.
Yes,
And in Robert's case, they were both transected or cut in half.
they are. Yes, sir.
There is another one too that it's going to be a long one, but it's where is it? Come on, where is it? Jodie and Tanya's secret trial list. Ooh, you can't see that one. Syringe jocks. The dipshit files. That's one of my favorites. Where is it? Oh, I had a Judge Fleischer playlist that was full. It had 23 videos in it, and then he deleted everything before Christmas. Gone. Everything off his channel. I saved the Lake and Riley trial. I'll wait for 12 months and I'll play that. I'm hanging for the Brian Walsh, but that's not later in the year. Where is this? I've got the Chandler Halderson trial. That's sitting there waiting. Madison Marshall, that's going to be a, yeah. Yep, that's going to be nasty. And where are those? Holly Tibbetts, there she is. Where's the other one? Come on. Small Town Secrets Murder. That one is, I think it's a 13-day trial. Yep. But looks good. Sounds good. That's terrible, isn't it? Sorry. That's awful phrasing. Let me see if I've got a closings. No, I want no. Where is it? Got a description for you. Hopefully. All right. In New Hampshire, Timothy Verrill is accused of brutally murdering 2 women, one of whom he worked for as part of a drug operation. Police found Christine Sullivan, 48, and Jenna Pellegrini, 32, dead on January the 27th, 2017, after they responded to a 911 call from a home in Farmington. There, police said that the homeowners, Dean Smoronk, reported finding the bodies. Smoronk and Sullivan lived in the home, and Pellegrini was a guest. Both Sullivan and Pellegrini had been stabbed, whilst Sullivan also suffered blunt force injuries. Their bodies were found beneath the porch of the home, wrapped in tarps, trash bags, and other coverings. Now, this is in New Hampshire. It's a new one, New Hampshire. And yeah, it's a 13 days, I think. So, but why was it called Secret? There was a better description than that. Small Town Secrets Murder, and I can't remember why. Why? Why, I tell you. Maybe it's on another one. Let me have a look. No, same. I know I read it somewhere. I'll find it. I'll find it. Eventually. All right. Sorry. Got distracted.
This wound, it cut through these big muscles, but did it also go all the way back to any of the vertebrae in the back of the neck?
Yes. The 3rd cervical vertebrae. The body.
Yes, we do.
Not the spinal cord. Does show an incised wound.
It's a joint playlist we share between us. It's easier for, like, if you're, having a look on YouTube and you stumble across something that you like, instead of writing it down, you just chuck it into that playlist, and I've connected Tanya to it, so she does the same, and then we go through them and choose the ones that we want to do together. Yeah. I'm more than just a yeast infection,
Presents the deepest extent of this injury. So from the anterior neck all the way back to the
Yes.
spinal column, not the spinal cord.
I will find
the
out more
spinal
details
column
on it because I
is a
know
very
there's more to it
superficial
than
incised
that.
wound, which is horizontal, meaning it sits in orientation on the vertebral body, much the same as the long axis of this wound, which makes sense.
Did the motion of this cutting and what you observed and saw, did it look like there was some sawing motion involved with this injury?
So it is my opinion that these satellite incised wounds indicate that this injury did not happen with one pull of the blade.
Oh,
This injury took multiple movements of the blade.
Oh.
Because we don't have large wounds in here, more likely than not, the blade was cut in and then there was movement back and forth. And as it comes up, it creates these satellite injuries. So this does represent multiple lateral movements of the blade.
We can go on to 29C. I mean D. I'm sorry, 29D. Can you explain what we're looking at? And I guess this is the side view.
I'll orient.
And then we'll talk about all those stab wounds, the little baby stab wounds.
Yes. So this is the left side of Mr. Robert Baker. We have, for orientation, this is hair. This is the ear. So we're looking at this side of the neck, below the ear. This is the left edge of the stab wound that was just shown. You see the larynx. This is not the ideal photo to show the internal damage, but there are several important findings in association with this photograph. At the far tip, left tip of this injury, we will see very focal, but clearly obvious superficial incised wounds. Just hitting the skin. No significant damage except perhaps that one. But once again, if this was made by one clean pull through, we would not expect to have 1, 2, 3, 4, 5, potentially 6 small incised wounds on the tip. These represent the superficial stab wounds as described by Dr. Bulick. These are all non-life-threatening. Superficial stab wound, superficial stab wound, superficial, superficial, superficial. I believe there's one down there. We count in total, I believe, 8 in this case. Non-life-threatening. The most important thing here on this photograph, though, for my analysis, are these little superficial abrasions on the tip, or sorry, incised wounds, not abrasions.
So let me ask you, Dr. Fulcher, each one of these stab wounds, they would require 5 of those.
I'm sorry.
That's
it's
okay.
Not 8. My apologies.
Each one of those would have required the knife tip to be inserted into the flesh of
Yes.
Robert for that to happen.
That is correct, yes.
And it would require, because there's no connectivity with them, it would have required a pulling out and putting back in for each of them.
Yes, that is correct. We have 1, 2, 3, 4, 5 stab wounds, and then the larger incised wound.
Now we move on to 29E. Can you describe mainly we're looking at this injury? I think we talked about these already.
We did.
If you could talk about what that is, doctor.
This is a abraded stab wound to the left side of the jaw. It's described as 2 by 0.6 left side upper neck, just under the jaw, downward direction, soft tissue, 1.5 centimeters deep. 1.5 centimeters deep in this area. Really just talking about soft tissue. Perhaps a little bit of minor salivary gland is injured, but nothing life-threatening here. For my analysis on this, I am impressed by the shape of this wound. It is almost like a fishtail, if you think of a forked fishtail. Usually that implies to a forensic pathologist, I would testify to this, of course, that the knife blade is inserted and then somewhat twisted or reoriented. That's how you take something that's linear and make something that has this unusual shape. So that would be my interpretation of this. This photograph is also excellent to illustrate these superficial incised wounds as well. They're shown in good detail here.
Once again, Dr. Fulcher, this would have been an additional incised or stab wound that would not be connected with any of these others, so it would have had to be inserted individually.
Yes, stab wound. Incised wound, stab.
And then, if I can refer you to, it is 29F. Can you tell us what we're looking at here, specifically, what's right here, why that's important, and if that's stab wounds, blunt force injuries, what that is, Dr. Fulcher?
For orientation, we are looking at the right side of the head. This is obviously the right ear, the right eye. These are indicative of blunt force trauma. These are contused lacerations. There are other pictures with the head shaved which show these in more detail, but these are not stab wounds. These are caused by blunt trauma.
Can you explain that a little bit? Because to just a layperson looking at it, it appears that they're like cuts. But can you describe why those are different? And let me zoom in a little bit.
Shaved photos are better.
Okay, so I can't get it to
It's okay.
zoom in, but if you can just explain why, how you know in your expertise that is.
While this is a linear defect in the skin, when I'm examining it and I pull it apart, the tissue bridges or connects together with the edges. If something is cut, it's a clean edge on each side of the wound. In blunt force trauma, little vessels and pieces of tissue will bridge the edges. We have tissue bridging, in fact, well illustrated on this smaller one, and it's definitely there deeper on this larger laceration. When I use the word laceration, that means a splitting of the skin surface due to blunt trauma. For a forensic pathologist, laceration is by definition blunt trauma, not sharp trauma. That gets misused a lot, but we are very particular about that terminology. So this is a blunt force trauma laceration to the right side of the head above the ear.
And Dr. Fulcher, what is this that we're seeing above his right eye?
This is a large semicircular lacerated wound with surrounding contusion and abrasion, also related to blunt force trauma.
So that was not caused by a knife.
No.
Now, if we could go to, we're going to go to 29G.
Okay.
Can you describe what we're looking at and why this is important, what to illustrate and if we, let me just go back to 29F. What would have caused this? Would this be consistent, those injuries, with being smashed in the head with a hammer?
Yes, that is a possibility.
Let's go to 29G. Can you describe what we're looking at and explain
Yes.
why it's important for the jury?
I'll orient the jury first. This is the skull. This is the top of the head. This is the back of the head. Autopsy procedure requires us to remove the scalp. We do that by making, on a coronal plane, a linear incision behind the ears, and we reflect the scalp both forwards and backwards. As we do that, we expose the skull. In this case, we have a depressed skull fracture and a subgaleal hematoma with basically a scalp hemorrhage, the membrane covering the skull, the membrane, but also a scalp hemorrhage too here. So this represents deep bleeding under the skin surface, and this area on the right side, which of course corresponds to our impacts near the ear, is going, actually, I'm sorry, this is going to be up here. It corresponds to our blunt force trauma. There are better pictures of it, but this is a depressed skull fracture.
So just so we're crystal clear, the cause of this, though, is through someone, Robert, being struck by an object on his head.
Yes, that's correct.
Could these injuries and would these injuries be consistent with being hit by a hammer?
Yes.
And 29H, if you can explain what we're looking at and then help us understand, based on this injury, what you can tell by that, how that helps you. And then,
Right. So this is the contusion. We were just looking at it. This is the depressed skull fracture, underlying that large laceration on the forehead. This is described as a 3.5 by 3 centimeter right-sided forehead semicircular laceration. The underlying frontal bone has a depressed ovoid fracture measuring 3.5 by 2.3 centimeters with underlying beveling of the bone. As he specified, internal beveling of the bone with bone fragments pushed inward. Not surprisingly, as impact occurs, bony fragments are pushed inward due to the force. One can make out the semicircular nature of this impact. The inward beveling implies that directionality of the blow, as it should be, is from outside to in. That seems silly with a hammer, but when we're talking about bullets, of course, that's important. But that inward beveling is indicative of impact coming from outside into the skull.
so looking at 29H, this photograph, you can actually see a semicircular area that's right there.
Yeah.
That helps you even further identify that it's consistent with the hammer.
Certainly it could be, yes. It is a round, hard object.
I'm going to approach and show you what's in evidence as states 21.
Mhm.
if you don't mind stepping in front of Dr. Coulter, we'll scoot down a little bit right here. And this is the hammer that was located by the police. Is this hammer look like it's consistent with being able to be utilized there? I'm not saying this is the exact hammer, but I'm asking you, is it consistent based on your?
Certainly, this hammer is consistent with those injuries, yes.
Thank you, sir. And looking at this knife here,
Yes,
this is probably the first time you've seen the knife, right?
yes.
So looking at
I
this
had
knife,
many
is this knife
objections.
consistent with what could have caused all the injuries to Robert Baker?
Yes.
Touch wood. It's actually been quite a smooth trial. Take note, Beverly.
So if you can, just so we understand, how many blows, minimum to possibly maximum blows to the head, did Robert Baker sustain that you guys can identify?
So, semicircular laceration to the scalp is certainly at least one. I would probably suggest there were more given the irregularity of this fracture pattern. This is not cleanly punched out. That could represent several. The two crescent-shaped lacerations on the scalp, on the ear, are certainly two. So that's three in total. Those do have, now those have a very nice circular punched out lesion, which likely represents one blood. One can compare that hole with this hole and understand that perhaps this is more than one blood. So that's at least three, plus the small thing on the chin, which would be at least four, probably more given the severity of the forehead injury.
Ultimately, Dr. Fulcher, for Robert Baker, what did you determine his cause of death to be?
Both sharp force injuries to the
Blunt
neck
force.
and blunt force trauma to the head.
So, in your opinion, ultimately, either of those injuries could have killed him, independent of the other.
Yes, the head injuries and the neck injuries are sufficient enough to cause death in and of themselves.
Did you see any defensive wounds on Robert Baker?
Not on Robert, no.
So you're unable to make any sort of opinion as to whether or not Robert Baker was awake during the attack.
That's correct. Yeah, I was going to say, are you talking conscious, alive, or awake?
I would say conscious.
So I cannot tell you whether or not he was conscious in this particular case. I can tell you
Doubt
his
it.
heart was beating. He was alive.
Yeah, he was
Because of the
bleeding.
blood and the contusion, that this would not occur.
Yeah.
This scalp hematoma would not occur if you were dead.
Mm-mm.
You still have fracture, but you're not going to have blood because there's no confusion. There's also pictures of the brain which show contusion. That would not happen if the heart wasn't beating.
Mhm.
Also the neck, the blood loss, the hemorrhage around that. The heart had to be beating during all these events, but that does not mean they're conscious.
And even though they've been
Sometimes
just a
in
couple.
order to make a determination about consciousness or what's occurring at that time, can you look towards scene photographs, defensive wounds, and other information you gather outside of the actual autopsy?
Yes.
And in Robert Baker's case, there's no evidence indicative that he was struggling or conscious during the time of the attack.
That is correct. I can't tell you.
Thank you, Dr. Fulcher. Are you okay standing up still? Need a
Yes.
break? Okay. Do you need some water? Thank you.
Thank you, sir. I appreciate it.
Now Titan's turn.
When was Robert Baker's autopsy done? Do you remember?
Yes. I have to look. It was performed 8/27/2020 at 1300 hours.
And the
Wait, I'm sorry. That's state. I'm sorry. It was performed at the same day, but at 10:10 hours. My apologies.
and the date of death that you determined or that could be determined was August 26th, 2020.
That's correct. Yes, sir.
Is it common for an autopsy to be done the next day, not the same day?
It is. It's very common. The scene has to be evaluated. The body has to be removed. So usually autopsies occur the next day. That's more or less standard practice.
And just so the jurors understand, the body just doesn't come to your office. You throw it in a closet. Do you put it in refrigeration, keep it appropriately preserved?
Of course, yes. We have refrigeration and security.
Hello, baby.
So if we move on to Tate Baker's autopsy, you had mentioned that was performed also on August 27th, 2020.
Yes,
His was just done later in the day.
that is correct. Yes.
Can you tell us? We'll start here. We've already went through what this is, but can you identify the number for Tate Baker?
Sure.
Which photo is this?
This is going to be. I'm sorry, I need to move these in.